Hey everyone, uh, excuse my appearance. I just came back from the gym, but I want to make this video while all this was still fresh in my mind. So I'd been doing a lot of thinking the other night uh, about my eyes, of course, since it's something I'm constantly thinking about is my vision. And I came up with this kind of hypothetical proposal that I wanted to hear what other people thought about and if they thought it was something that's fair, which I believe it to be. So basically, this proposal would be an agreement that any surgeon, refractive eye surgeon, who is willing to continue performing these procedures must agree to. And basically, the proposal states that the surgeon is willing to endure any complications that their patients experience as a result of them operating on their patients. Obviously, there's no way to actually enforce such a rule, but I think it makes a lot of sense. I mean, they're knowingly performing this super dangerous, unnecessary surgery, and it's impacting so many people's lives in such a negative way. Shouldn't these people, these surgeons, be held accountable for their actions? So let me give you an example. Let's say a surgeon performs 100 surgeries, and we'll be generous here and say only 3 of their patients have any complications after the surgery. Let's say the complications are just a few, and something like severe dry eye, maybe excessive daytime glare, and let's say reduced contrast sensitivity. So nothing too crazy, but still none of them are fun to deal with. The surgeon would have to be willing to take on these complications, and they would have to take them on in the most severe form that any one of their patients is experiencing. So basically, if someone's experiencing glare, the surgeon's going to have to experience glare to the level of who's ever experiencing it with the worst. So I know this is, like I said, purely hypothetical situation, and none of this could actually be enforced. But when a refractive eye surgeon agreed to something like this, if it was doable, I mean, don't they believe enough in the surgery and its safety, its efficacy, and its necessity that they'd be willing to accept such a scenario? Fortunately, the statistics you get from most surgeons about complication rates are, at least from my experience, they say 1% or less. And they're usually willing to, maybe if they even mention complications, they're only going to mention the most benign ones, such as, dry eye, distortions with lights at night vision problems, reduced contrast sensitivity, stuff like that. Like I said, which none of them are fun, but I've experienced them, pretty much all of them, and I know there's some are more debilitating than other ones. And lots of times they'll even tell you that these complications are, temporary and they're not permanent, and that they'll go away over time, which is obviously also wrong. So if they actually believe all this, wouldn't they be willing to put their money where their mouth is, so to speak? I mean, they're making so much money off this, safe and medically necessary procedure. I mean, that's what they consider it. That you would think they would have no problem agreeing to such a scenario, let alone at least getting the surgery done on themselves if they, have corrective lenses or, any type of myopia or whatever. Well, of course, it turns out that they would never agree to this hypothetical scenario. Like I said, let alone most of them even considering ever getting the surgery themselves, because what they say regarding the safety and everything, the surgery versus what they actually know and the reality of it are two very different things. Complication rates in reality are way, way higher than they make them out to be. The surgery does permanent damage to the eye, regardless if you have any complications or not. They also do not mention that, more than a quarter of the potential issues that you can have from the surgery, such as some of the, like I said, some of the really debilitating stuff. And it's just, it's crazy. Honestly, it's mind-boggling to me. I mean, how many other elective surgeries out there are people taking their own lives over, due to these horrible complications? I mean, I've heard that the number somewhere around 25 suicides linked directly to these surgeries. There could be more. I personally know of at least 5 within the last year or two, and I've heard stories about many other ones. And I don't want to make this about myself, really, because I made other videos explaining my issues and stuff, but I do have about a dozen different visual issues that I developed pretty quickly, and it's just, I couldn't imagine living the rest of my life like this, to be honest. It's just the pain and suffering from this and how it's disabled me and taken all my joy from doing, out of life. It's just, only one can handle it and endure something like this for so long. I mean, I'd really just love to have my surgeon just be able to look through my eyes for a week and just see how horrible my vision is. I guarantee you, it would change his life and he'd never perform another refractive eye surgery again. And if for some reason he just decided to continue performing these surgeries despite actually seeing how horrific my vision and consequently my life has become because of it, then he's on a level of evil somewhere, I don't know, between like Hitler and Stalin, just pure evil. I just really wish these surgeons would stop believing their own bullshit. I'll give you an example. When my problems started to get bad, I went to a surgeon who was supposedly, an expert at performing these surgeries, a guy that other surgeons consider an expert and send people to. And, this asshole, who he'll remain unnamed in this video, had the audacity to say he had never seen anybody over his 30 years or so, or however long he's been practicing, anybody like with a case similar to mine with all these issues. And I was just like, really? I mean, I can't be that special and unique that you've never seen anything like this, or you haven't seen other people develop issues. And it's just crazy. It's like the man promotes the surgery more than probably almost anybody else, yet this, excuse my language, this fucker, that's the best way to describe him, he's wearing glasses. It's like, okay, so A, you had the surgery and obviously it didn't work, and yet you're still promoting it as the best thing ever. B, you were not a candidate for obvious reasons, like I wasn't, yet they still did the surgery on me. And if a surgeon says they didn't have the surgery because they're not a candidate, this or that, usually that's a cop-out, because obviously they don't want to go anywhere near the surgery and have it done to them. And, I wouldn't blame them, knowing how dangerous it is. Or C, they just know how damn risky and crazy the side effects are. I mean, they have to know a little bit about it if they're performing it. And they know how dangerous it is, and they would in no way want to put their vision in jeopardy. Because, eyesight, it's so important. It's like one of the most important things we have. And who wants to put that in jeopardy? So, I guess the whole point in making this video, besides just being able to vent, because I need to, is if surgeons aren't going to stop doing these procedures, then please be just more upfront with how dangerous they really are. If you're not going to stop doing them, at least just be upfront with what can really happen as far as complications, the actual complication rate, and what you're really doing to the eye and how it's damaging it. And just really be conservative when you're screening your patients for people who are potential candidates, although I don't think anyone is. But obviously there's predisposing factors that are going to make someone at higher risk than somebody else. And I had a few of those factors that made me at higher risk for issues, and I'm paying for it now, but I didn't know about it. But my surgeon could have at least said, hey, you're not a good candidate for this, so we're not going to put your vision in jeopardy. And I wish, at least do that if you're not going to stop performing the surgeries. Be straightforward in the way you promote it in your advertising. Stop all the lies and the bullshit. Stop being deceitful. And God forbid, if one of your patients has issues, at least show some empathy. Don't, like what happened to me. I go back there, they misdiagnose me, they say it'll all go away, and the worst is they act like you're crazy, like you're making up all this shit, and they try to rush you out as quick as possible. They don't want to hear it. They don't want you to be there because they don't want their potential patients or victims to hear about any of this. And it's like, God, and that's like the worst. I mean, I just want the lies and everything to stop. I refuse to stay silent while there's hundreds of thousands of people suffering from issues caused by these unnecessary procedures. These so-called ophthalmologists that perform these surgeries, they're nothing more than a shady used car salesman. And I have a lot more respect for that car salesman, no matter how shady they are, because at least, what they're doing is maybe they're selling you a defective or a bad product, but, and obviously that sucks, making a major purchase and having a bad product, but you can still move on. It's not going to ruin your life like something like this would, with the impaired vision and the potentially agonizing pain you can get from these surgeries. So, despite how it sounds, I'm not a spiteful person, but obviously this whole situation has made me pretty bitter, and I feel like the old saying, an eye for an eye, really, applies in this type of situation. It's the only way you're going to get these butchers to stop destroying people's eyesight, people who were trusting and obviously naive, but they thought that these surgeons had their best interest in mind. Just people need to stop putting doctors on a pedestal. And it's not just these surgeons, although they're like the worst as far as doctors, but any doctor. I mean, just because you have a bunch of schooling and a medical degree doesn't mean you really know anything. It doesn't mean, that you're a sincere person, and it really doesn't mean you're a good human being at all. So I know there's going to be some people out there that obviously don't agree with my views or opinions on this subject, and that's fine. You can feel free to comment, write, whatever, and we can have an educated debate on it. And I believe if you're a logical and caring individual, you'll probably understand where I'm coming from, and you should probably have no problem seeing, my viewpoints and how much sense they actually make. It's just what this laser eye surgery and just refractive eye surgery industry in general is doing is just completely unethical. It's criminal, and it needs to be stopped. So I can't think of anything else to say. So thank you for watching the video, and have a great day.